welcome back to Orlando Matters. I'm Keith Landry. Joining me now is Malia Johnson. She is an advocate for people who are deaf and hard of hearing here in Central Florida and across the United States. And an amazing person. Thanks for being here this morning.
Good morning.
Your story is amazing. Just so you know, folks, Malia was born deaf. She has never been able to hear, so she's never heard in her whole life. But through intensive therapy, she has learned to read lips very well and can speak, and of course knows sign language as well. I want to start with that part of your life, this amazing accomplishment of never being able to hear, but yet learning how to speak very well, I might say.
Yeah, it was really amazing because my parents made sure that I was able to lip read. Though I went through many years of speech therapy, learning how to lip read and speaking words and everything, going through 6 hours a day, 7 days a week for 16 years of speech therapy to understand it. Then I went to school without an interpreter, but that was a challenge too. So over the years, I developed my speech and had to practice. And then I became a little bit better over the years. So now I'm not an expert, but I'm getting there.
Yeah, I'd say you're pretty darn good. So you become an advocate for people who are deaf or hard of hearing. What do you do, and what is the stand you take on that?
Being an advocate for the deaf and hard of hearing, I believe in being an advocate for them is to help educate the community, interpreters, any profession out there is to understand the need of hiring an interpreter, qualified interpreter, not just a student or someone who says, oh, I know sign.
Right.
You know, oh, I've taken 1 or 2 classes. Oh, I can interpret for you.
Yeah. That's not it.
Yeah, not really. Yeah.
So you focus on that. You actually have a new book that focuses on that topic. It's called ASL, A Practical Guide in the Medical Setting. And this, what does the book focus on?
That book focuses on medical. And it's so important that we make sure that the doctors, that the deaf, and interpreters understand the meaning of having the right interpreter for medical settings, to make sure that they have the interpretation, understand the terminology. Because if you go there and there's a deaf person there and they're interpreting something, you can have a simple cold. Yeah. It could become something more serious, and that interpreter doesn't know how that feels or something, or can't control it, or, oh no, what do? They go to an emergency, or they're not interpreting appropriately. That deaf person doesn't get what they need, and it could mess up the possibility of getting the information they need. It's so important to make sure that you don't, interpreters do not accept the job they're not qualified for.
Good point.
It's important for the deaf also to speak up. Say, hey, ooh, I don't understand you. Please say it again. Make sure they fight for themselves as well. And doctors, too, say, we need to hire interpreters, not just family or friends. Make sure you bring in a qualified interpreter and pay for it. It's worth it. You get that collaboration.
What about governments and businesses when they need to hire an interpreter for a large event or a meeting or public forum of some sort? What do you say to them about educating themselves about who they should hire?
Well, what's important about that is you would let them know there are variations of interpreters out there. How could you educate them? How can you understand how to work with interpreters, how to work with the deaf? How do you communicate with those two? Like, for example, you and I are talking to each other to make sure I lip read you.
Right.
Not all deaf can lip read.
Okay, sure.
They can only capture maybe 20 to 30% of what you say.
Okay.
So,
you've had intensive training on lip reading.
Yes. Yeah. So, and having an interpreter there makes it very clear to understand. It could be very in-depth vocabulary. It could be so much going on all over the place. If it's one-on-one, it's a little bit simple, depending on the ability of the deaf person. Like, I could do one-on-one. Some others could do one-on-one. Some prefer to have an interpreter because they capture everything that's so important to, okay, I feel more relieved. Okay, now I feel I got it. I can take care of it. I have control. No problem.
Well, you have a website where folks can learn a lot more about what to do if they are hiring and so on. What's the website?
Well, my website, talklc.com.
Okay.
It had that information about the book on there. It really, I have an interpreting agency as well, and we provide interpreters for all kinds of services.
Okay.
But it doesn't really talk about the advocacy there. We do provide a service for advocacy.
Great. Thank you. Malia, we are out of time, but thank you so much for being here today. I appreciate it.
You're very welcome.
Her website is deaftalkllc.com. Have a good weekend, folks.